Good morning, good afternoon, good evening. Yes, good morning from New York. So welcome everybody to the webinar, Lessons Learned and Opportunities, Linking Social Protection Systems to Humanitarian Cash in a Pandemic. What we like to do is start with a poll, and you will see it show up on your screens right now. We'll just leave it on for about 20, 30 seconds. And the thing is, if you can just select, please, one of the following. Are you from the humanitarian side or the social protection side? Normally, we also have the option of both. But if you can just say which side you might be more, which side you self-identify with more, humanitarian or social protection. And we do this because one of the things that we are trying to do is bridge the two sides together, but also it gives our panelists a chance to know who is in the audience so that we can tailor our remarks and interventions a bit better to our audience. We try not to use acronyms where possible, because we do have people coming in from both sides of the equation. I am going to let the poll run for another 5, 4, 3, 2, 1. And as you can see, we have a pretty good split in terms of humanitarian and social protection actors, 60% humanitarian as of right now, and 40% humanitarian actors. Just to start us off, and we can go to the next slide. I wanted to go ahead and first of all talk a little bit about the webinar series. This is the 5th webinar in both series, because we're looking at both options right now in terms of the social protection responses to COVID-19 webinar series. That it's a joint effort initiated by IPCIG, GIZ on behalf of the German Federal Ministry of Economic Development and Cooperation, which the acronym is BMZ, and the Australian government's Department of Foreign Affairs and Trade, DFAT. This is in collaboration with socialprotection.org platform, and it's in cooperation with partners from different organizations. Just to sort of say, and you can see that the initiative has 3 major components. They've got a dedicated newsletter featuring a compilation of relevant information from around the world. They are doing weekly webinars. These are normally on Tuesdays. And there's also an online community, which I think the organizers will go ahead and post how you can access all of those different things. And if we can go to the next slide, because we, as part of the Grand Bargain subgroup, this is also the 5th webinar in our series. We are very pleased to be linking up the 2 initiatives around these webinar series. The Grand Bargain Cash subgroup on linking social protection and humanitarian cash transfers has been working with socialprotection.org on this webinar series, because again, the whole entire point is that we are able to bridge between the 2 actors. We are co-hosting this today with the CALP network as well, which we are very excited about, and we do have a representative from CALP who I will be introducing shortly. You can see the different social media links, etc., that are up there. Also, just to very, very briefly mention that the next webinar of the social protection responses to COVID-19 is going to take place on the 21st of April, and it is about the impacts of the COVID-19 crisis on employment. So that link will also show up for you in the chat function. If we can go to the next slide, I can quickly introduce our different participants that are panelists that we have. And I will start with Natalie Klein. And Natalie, if you can just wave so that everybody can see who you are. Natalie is the CALP Network's West and Central Africa regional representative. She joined CALP in 2014 and has been since then working with the regional team and CALP's members and partners to fulfill cash transfers transformative potential to make humanitarian assistance more efficient, transparent, and dignifying for crisis-affected populations. She's been working in West Africa in various positions for quite a while now in both the development and emergency sides. Thank you, Natalie, so much for joining us. Next, I'd like to introduce Gabriel Fernandez. Hi, Gabriel. Yes, very, very excited to have Gabriel. He is a social protection specialist and has been involved in social protection for the last 15 years. His first introduction and involvement began in Zambia in 2003, where he served as the Chief of Child Protection in UNICEF. In 2010, he returned back to Liberia, his home country, and he worked in government in Liberia from 2011 to 2018, first for the Ministry of Planning and Economic Affairs, and then the Ministry of Gender, Children, and Social Protection. He is now a freelance social protection specialist and continues to support in an advisory capacity for social protection programming in Liberia. Beyond that as well, he is supporting efforts to strengthen the Francophone community of practice on cash transfers and is engaged in other initiatives such as the Grand Bargain Cash Workstream and UNDP's initiative in supporting social protection as a catalyst for advancing the SDGs. So welcome, Gabriel. It's excellent to have somebody who has that mixed profile that we look for quite often, but also has the experience in working in government on these links of humanitarian cash transfers to social protection. Lastly, I would like to introduce, very super excited to have Callum McLean with us as well. Callum has 30 plus years experience in humanitarian and development work, most recently as ECHO's global advisor on cash and basic needs. And by recently, I think end of February is when Callum has transitioned to being an independent consultant working on humanitarian cash and the linkages to social protection. And he is currently advising on COVID-19 response options, focusing on the secondary impact of the pandemic in developing countries. Very quickly, I probably should introduce myself as well. I'm Zara Rizvi. I'm working on knowledge management aspects for the Grand Bargain subgroup on linking social protection and cash, and we don't need to introduce me anymore. If we can change the slide. Just to very quickly run through the kinds of objectives that we will be looking at in this webinar, and it's to be able to start, like we will start with understanding the peculiarities of a global pandemic and the kinds of effects that it has on linking humanitarian cash and social protection. We will look at lessons from other contexts, Liberia specifically, and how they can be applied. And we are going to look at, we really want this to be quite discussion heavy. So we'll look at discussing the entry points where we can be linking humanitarian cash to social protection. And, we're opening this up very, very much to a Q&A session. So we will be looking at, recommendations, possible solutions. Nobody's got all the answers right now on this evolving situation. We are going to start with a video, and we're going to see if we can make this work. It might be one of the first times it's definitely the first time it's happening in the webinar series that we have going on. But I'm going to give a chance. I'm going to continue to keep speaking so that we don't have empty space while the screen gets changed and that video goes on. We have a short clip. It's less than a minute from BBC Newsnight, and this aired on the 8th of April. It was Emily Maitlis who had done this, and we wanted to show it in terms of a good setup for what we are looking at and what it is. And as a reminder for the panelists to mute their mics so that we don't have that echo. So this is a health issue with huge ramifications for social welfare, and it's a welfare issue with huge ramifications for public health. This is a myth that needs debunking, that the effects of this will be across, that the effects are going to be equal across. And this is really where we come in. This is really what many people have been discussing and looking at, both from, we can see huge government programs taking place right now. And if we can go to the next slide, so why are we here? This is not like any other humanitarian situations that we find ourselves in. Firstly, as we heard, everyone is affected, but the effects are different across the board depending on people's pre-COVID situation and also what is happening just right now. We're seeing many social protection programs being rolled out by governments. It's amazing, and mainly, and from my perspective, this is what I've been seeing and been very, very amazed at how quick and innovative many of them are. But as we know, and we heard it in the webinar that took place last Tuesday, I think, it was one of the first ones that happened, setting the scene for the webinar series, the coverage is going to be an issue. So it is not going to cover everybody. And this is where the humanitarian community, especially the ones working on cash programming, can come in. We're seeing quite a few social assistance programs being rolled out by the government, and that tends to be one of our entry points into this. So what lessons do we already have that we can apply? What do we need to be on the lookout for? And very much, what can we be doing in the short, medium, and long term? So we're using lessons from Liberia and Ebola specifically today to ground us in what there was learned there already on linking social protection and humanitarian cash transfers in a health emergency. And then Gabrielle will lead us through that one. Then we will have Natalie, who will lead us into a more regional sort of perspective, and then we will have Callum offer some reflections from past and current experiences before we move into the question answer discussion side of things. We have left ourselves very, very flexible as a panel. We are trying to keep our interventions as short as possible to leave quite a lot of time and space for the Q&A and discussion. Please continue to ask your questions as you go along. And we'll be compiling them and we'll get to them shortly. But with that, everybody else except for Gabby can turn off their cameras. And Gabrielle, over to you.
Thank you very much, Zara. So I'll be sharing the lessons learned from the Ebola crisis in Liberia. Let me first report it into context. First, it was a health epidemic with severe socioeconomic impact. We had, first of all, various stages that we see now in COVID: denial, fear, stigma. I just want to underline the importance of understanding what I mean by denial. I think there are two aspects to denial. First, denial that it was not actually happening. And when the deaths begin to increase, that led to fear. But there was also denial linked to a fear of loss of livelihood. And for the poor, they cannot stay home. So there was the denial and the fear, distrust of authority. So part of the response was basically how to restore trust in authority. And then there was the mitigation and containment measures. And these sort of created now loss of income, further deterioration of livelihood, and increased vulnerability to different type of life cycle risks. In that, now was as part of the response was how do we begin to identify the most vulnerable? And this highlighted the importance in the case of Liberia of having a household social registry. So with loss of income, deteriorating livelihood, cash became a very important humanitarian response. And we had 15 partners who were beginning, who had as part of the plan to implement cash. So cash was vitally important, but we realized very soon that cash in itself was not sufficient and that there was need to complement that with other services to strengthen livelihood and in particular to build resilience. The next slide, please. So in fact, sorry, there should be another slide before that. So at the policy level, what was important was there an existing policy? And in the case of Liberia, already had a policy and a strategy that had just been endorsed by the cabinet in 2013. So that provided a framework for identify what is social protection, what guide the response. The second element was coordination, which was vitally important. And in fact, Ebola forced everyone to coordinate because the death level and the uncertainties around what to do was so high that if we did not coordinate, we will all be impacted by that. And so there was very level of coordination that was mechanism that was set up. We had in the case of Liberia what we call the cluster, which was initiated by the UN. And I mentioned that because what's vitally important, the lesson learned, is that when you have a cluster approach, you have various types of cluster. So it's important where cash transfer is situated links up with other clusters. In the case of Liberia, the food security cluster was a very important cluster to link up with. We had clear terms of reference with roles and responsibility, very important. Another element to consider was that at the policy level, did we have the capacity to make vulnerability assessment, market analysis, and in particular, who were the service providers? And linking that with that, whether there was liquidity, availability on the market. And lastly, was around mobilizing financing. Very early, an Ebola fund was established that allowed for donors and other parties to contribute, and remittances from abroad, which in the case of COVID may not be a function that may create a financial gap, was very important for us because at least with the remittances that could also assist both direct support to household, but also to the Ebola fund in the overall financing of response. Next slide, please. So at the program level, and thanks to Valentina, Fabio, and Beasley for their framing of social protection in COVID, because we look at, this is the framework that I'm using, looking at policy, program, and administrative level. So at the program level, we established a cash working group. Now, in this case, it was the government that took the lead, but in many other instances where there's no government lead, this is where the humanitarian could play a very important role. So both in terms of taking the lead, where there is no government lead, or be co-lead to the government. We had, as a very useful tool, we had the 4W matrix, but it was actually initially a 3W, what, whom, where. But we realized very quickly that there needed to be a fourth W, and that is when. So the 4W matrix was very useful in terms of gauging the response of various partners, avoiding duplication, but also what it did was to ensure that we're able to ensure the largest possible coverage and harmonization of our transfers and the comprehensiveness, as Valentina explained, in terms of how many of the risks are actually being addressed. So we also established 3 sub-working groups around targeting, payment mechanism, and monitoring, which was actually led by various partners. So one, it ensured ownership to the working group being part of it. And then also it enabled us to tap into the skills that existed among the humanitarian actors. Secondly, and this is very important, one needed to distinguish between cash transfers and other types of remuneration, like hazard pay, which became now a commonly a term for remuneration to health workers and the frontliners. But cash transfer, it is important that it's understood, is different from remuneration and an incentive that's given to other frontline workers. So that was very important for us. Once we established that, now it was how do we begin to identify beneficiaries? So Valentina raised that in one of the earlier webinars, looking at various data sets in the country. In the case of Ebola, it was the health data, also data of ETUs. ETUs basically was the Ebola treatment units, so those who were admitted and those released, and in particular the families of the victims were also identified as requiring support. Harmonization of tool, I mentioned that earlier. How, as part of the cash working group, how do we harmonize our tool? And one of those was like the post distribution monitoring tool that was shared amongst all the other partners. And lastly, and very important again, was communication to beneficiaries, ensuring that we had the right type of messaging in terms of prevention, that they knew the entitlement, and again, the duration, how long this transfer was going to last. Next slide, please. So the next slide was on administration. And basically here, the key element was the engagement with local authorities and communities and getting their involvement in terms of not only identifying, but also as validating the enrollment, those who were beneficiaries, identifying payment points for payment, and being part of the monitoring with focus group discussion. And lastly, around complementary service, which I mentioned earlier on, linking with social services in terms of psychosocial support and other support to household, like hygiene kits and school kits. So these were also very important. As I mentioned, cash on its own was not sufficient, and we needed to complement with other services. So let me end on 5 key takeaways. So the first was coordination, as I mentioned. And like I said, for those countries that have a cluster approach, that may be a very useful entry point. But where the government is actually the leader, had different mechanism, is to see how to partner with the government and to support national lead. Equally important with coordination, what it does, it allows for the maximum coverage, helps us to determine the transfers and the adequacy of transfers, and then also maximize the comprehensiveness to mitigate life cycle risk. One thing to remember is that coordination leadership requires a dedicated staff and financial resources. Secondly, community engagement, like I mentioned earlier on, vitally important. This is what we learned from the Ebola. Getting the community involvement was what actually helped to mitigate the spread of Ebola in Liberia and building their capacity in that process. Thirdly, investment in communication with behavior change outcome. And as it cascades down to the community, popularizing the messaging so it becomes as simple as possible and letting the beneficiary know the entitlement, how long do we receive the transfer for, very important. Valentina again mentioned this, and I like this, act in the short term and think in the medium to long term. And this is critically important. What we found in Liberia with Ebola is that there was already a long planning for a response to Ebola to go all the way up to the end of the year of 2015. We woke up and Ebola was gone in January. And so very quickly, you went from an immediate response to now a recovery. And if you don't begin to plan for the recovery as part of the immediate, you find yourself missing out on funding opportunities to address the recovery phase, which is so important because if you don't do that, it can undermine any efforts in the immediate that was done for the as part of the immediate response. And lastly, as an opportunity to invest in social protection system building. Like I mentioned, the social register is a very good starting point, but also coming up with vulnerability surveillance and triggers for the next shocks. Well, I said thank you very much, and Zara, I pass it back on to you.
Thank you, Gabrielle, and thank you for keeping it short. I know how difficult that is, and we can share as part of the blog summary further in-depth information on the Liberia case study. I love that you've got the key takeaways set up as you have, and just to also mention a couple of points that you talked about in your presentation, having those clear terms of reference around coordination and how incredibly important that is. It's one of the key lessons and good practices we also have coming out of Turkey and the Emergency Social Safety Net program that is going on over there. It was mentioned over and over again in the webinar that we had that was dedicated to that case study, and that, you know, having that coordination, clear TORs, and how that was working quite well. So I think that's a really important point for people to be able to take on. I also really love that, you know, the fourth W around around when, and you know, so that responses can be planned a lot better. It's something we were trying to do in the Bahamas after Hurricane Dorian, saying who's got this kind of funding, who has this kind of funding, so you know, so that we could be piggybacking off of everybody else's, you know, off of each other's funding, so that, you know, because donors have different ways of doing funding. There's different funding mechanisms out there, so you know, how was that working, and who could get more money later on, and who could act now, which goes into that point about, you know, act in short, think in medium. And I think this is so true for what we're looking at within this pandemic situation. And also what you were talking about in terms of other services needed. You know, we are, and this is a webinar around linking social protection and humanitarian cash transfers. But it is so much more than that. And, you know, where are the referrals? What are the other services? Cash is a tool at the end of the day, regardless of who is distributing it or where the planning is coming from. But with that, thank you very much. And it segues hopefully quite nicely into what Natalie is about to present to us. So Natalie, if we can get you on to give us a little bit more of a regional perspective.
Thank you very much, Zara, and thank you very much, Gabrielle, for sharing your experience in Liberia with the Ebola crisis. So there are a lot of lessons learned that we can take from the Ebola outbreak, with a few important differences though, especially the fact that opening up a bit the conversations to the wider region in Western Central Africa, what we see now is that though markets are of course impacted by the crisis, there are less tough and radical restrictions on market as what we've witnessed during the Ebola crisis. And also the COVID outbreak is so far most urban and much more urban than what the Ebola crisis was. So drawing from what Gabrielle just shared, I would like to give a few key points, and I will try to keep it as short as possible. So first, if we look at sort of the big picture, in Western Central Africa, I will never highlight as enough what Gabrielle just shared as regard of coordination. The epidemic is really an opportunity for very strong call on governments to play a very strong leadership role. And what we see in this region is, despite the efforts and the greater uptake this recent year in on social safety nets, there is very still little use of social safety nets as a COVID response option, but we have a few very interesting experiences at the moment in Cabo Verde, in Nigeria, and in Togo, with a very interesting registration process using a phone number and an online platform. So maybe we could go back to that a bit later in the Q&A session. We also have Mauritania and Burkina Faso that have announced safety nets initiatives. So that makes it not only feasible, but very much appropriate. And there is much more advocacy to be done to make sure that what made the cash response feasible in the Ebola outbreak, which is the strong government leadership, is still is taking place, is happening in this COVID crisis. So building on that, we also need a stronger and clearer definition of roles between humanitarian actors, non-government actors, and governments with the donors' support. In the Ebola response, USAID played really a critical role in pushing actors to collaborate, especially when social safety nets are externally funded, but not only. And it was really an enabling factors to have humanitarian actors and governments sitting in the same seat and setting up this cash working group with a strong leadership from the government. And this is something that is to be considered in all countries where you have a humanitarian-led cash working group, how to make sure that the government is not only sitting in this cash working group, but possibly leading or co-leading the cash working group. This really makes the connection much more easier. The nature itself of the health crisis needs a much more limited numbers of interventions. We know that ideally we would like the coordination to happen, whatever the type of crisis is, but the reality is that in the Sahel, very often we still have several actors implementing cash in same areas. In a sanitary crisis, in an epidemic, there is not much space for this. And so we need a much more maximized and rational use of resources and making sure that we don't have several actors coming to make some distributions, of course, because of the risk of spreading the virus. The strong leadership from health authorities and the sanitary measures that come with the outbreaks creates a sort of a natural shift to a greater government leadership, sort of restoring the legitimacy of the government. And we often talk, when we talk about connecting CBA with social protection systems, we often attack the subject with saying, how can humanitarian CBA strengthen the social protection systems, which was really a success in the Ebola outbreak, but we also should not miss the role of the government and its expertise and its added value and its legitimacy in bringing together the different actors that should be involved in the response, and particularly the private sector actors. The government have the leverage to act on regulations, to facilitate the payment mechanisms and many other aspects of the response that humanitarian actors usually struggle with. We've seen that with the decisions and the direction made by the BCAO in West and Central Africa, and also in Niger, where the government is working with IMF that maybe the humanitarian don't think about. So we should also think about all the added value that comes with the strong government leadership. So on a last point with the big picture thinking, despite this strong government leadership, doesn't mean that the space for humanitarian expertise is shrunk at all. The operational expertise, the flexibility, and all the last mile solutions that the humanitarian actors are used to work with are incredibly valuable in such context, especially in West Africa, where the social safety nets are really starting to develop and the social protection systems are still quite weak. There is little experience at government level in delivering large-scale cash transfers, especially in challenging operational context. And so the humanitarian expertise here on using different delivery mechanisms, switching from one modality to another one is extremely useful. And I think that Gabriel also highlighted it very well in his presentation. At the end of the day, the humanitarian can be those who make things happen when the government decided what should happen. So as Gabby mentioned, there is a very strong role for the Cash Working Group to make the connection, to catalyze humanitarian knowledge and expertise and making it available to the government. So whether it is led by the government or not, there is a function for the Cash Working Group to ensure that connection with social protection system authorities, also the health ministries and all the key actors involved in coordinating the whole response. So if we manage to reach this level of complementarity, there is no reason why we should not be able to do quick and good. Feasibility can be built, capacity can be built, and crises are often very good opportunities to go faster and to make things happen. So now if we go like for 2 minutes on the details, basically there are two types of contexts. So where the government social safety nets already exist and where cash is delivered by the governments. So here we tend to think that humanitarian CBA can more focus on expanding the coverage, as Zehra said in her introduction, and targeting specific groups that may not be the priority of the government. Here in the region, it would mean, for instance, maybe the IDPs or the refugees that are already somehow known by the humanitarian actors. So it's less of an effort to come to targeting, to registration, and we know that this is quite complementary with the usual targets of the government. That could be also some top-ups on the existing safety nets, trying to deepen the assistance to the population. So that would be in this region. It would likely be more countries like Togo that has already developed their safety nets, or Mali, where the government is already delivering also safety nets. But the targeting, of course, will always depend on the objectives of the program. When the government may focus more on protecting livelihoods, for instance, and targeting the informal workers that are losing their incomes, maybe the humanitarian actors will focus more on life saving and the people suffering from food insecurity that may have additional needs resulting from the crisis. So in other countries where the social safety nets are just nascent or even non-existing, which is unfortunately a very common context in this region, the humanitarian cash actors have a key role to play, as I was saying, on the delivery and making things happen and the coverage expansion. So that is what could happen in either Burkina Faso or Central African Republic, where there are some starts of social safety nets, but we know that the delivery challenges can really slow down the government response, and where humanitarian actors have really a key role to play. So saying so, collaboration must go really beyond delivery. We should not only focus in like connecting humanitarian CVA and safety nets on the delivery aspect. I think that Gabby really highlighted that the benefits of the collaboration between the government and the humanitarian actors in the Ebola crisis in Liberia went much beyond these delivery aspects. Liberia is, by the way, one of the first countries in the region who have started to think about safety nets as a COVID response option, which I think says a lot about the learnings from Ebola. There are many opportunities to strengthen systems and maximize tools, and of course we focus a lot on challenges, but we could also see this as an opportunity to make some things happen. The Regional Platform on Social Protection in West Africa has developed a tool that has been shared with governments and cash working to help them connect humanitarian CBA and social protection systems. And we are trying to provide that support. Donors also, humanitarian donors, are trying to see how funds or programs could be maybe reallocated for a response. Everybody is trying to see what they could do. And as learned during the Ebola crisis, the main progress may not be on actual delivery. That may end up being just humanitarian cash because it's the fastest way and only humanitarian actors know the service providers and know how to deliver cash. But strengthening the social registries, developing solutions to put in place a more favorable ecosystem for digital payments, aligning amounts, building on the MEBs, all those things that we struggle to develop in more, I would say, quiet periods sometimes they need an emergency to be set up. And so in that sense, I think that we should see this moment as an opportunity to really push hard for the development of social safety nets and making this connection finally happening. So that's where it's my key points.
Thank you so much for that, Natalie. And just to piggyback off of, what you were just saying, is to use this as the opportunity to push on those things that it does become difficult to do in peacetime. But I do also want to mention this whole entire thing around delivery and digital payments and different ways of looking at it, because this is coming up over and over and over again. How do we do the delivery? There was an excellent webinar that happened on, not yesterday, what day, all the days are merging together at this point, on Tuesday, and it was around G2P, so government to person or people payment systems. And I would like to caution around, that, we as humanitarians can have these different delivery mechanisms and all this digital stuff, et cetera, because at the end of the day, we have KYC, know your customer requirements, etc., that we are also looking to meet, and the people who are holding on to that, or the entity holding on to those sorts of regulations and can waive those regulations and do something to make it a little bit easier for us to register people, is government. So we might have these wonderful mechanisms, but again, it is so key that everybody at the different chains and different places are indeed working together. I will leave it at that because of time, and thank you very much. And I would like to invite Callum to put on your video and offer your reflections moving forward. Thank you.
Okay, thank you very much, Zara. I think there is another slide. Yes, here we go. So yeah, thanks very much, and thanks very much to the previous presenters. I'll try to build a little bit on what they have been saying, but also take us kind of maybe into a slightly different area, and then finish up on with some thoughts about how to go forward. So first of all, I think it's whilst the Ebola experience is obviously very, very important to learn lessons of and to bring into the COVID-19 experience. I think that one of the fundamental differences is that Ebola was what still is in some places a particularly health related an emergency, and COVID-19 is also obviously health related. It's very importantly going to affect people's ability to survive ultimately. But the secondary impacts of COVID-19 are perhaps greater than the primary impacts, and particularly in the developing world, because a number of different factors come into play, but one of the big ones is around the demographics. So whilst COVID-19 and Ebola, do not discriminate about who they infect. What does happen with Ebola is that people of different age groups are very much threatened, and a very high fatality rate. With COVID-19, it's not like that at all. Obviously, the spread is much greater. But the impact on people, well, on mortality is very much related to age and underlying health issues, but primarily age. And we see that in developing countries, there are much younger populations than in Europe and in North America, for example. So just to give you an example, I think there's something like 2.6% of the population of Yemen are above the age of 70. So it's a tiny, tiny proportion of the population who are actually at risk of dying from COVID-19. That said, of course, I don't want to undermine or belittle the health impacts of the primary impacts of COVID-19, but just to put it in perspective. Now, the secondary impacts, I think, are particularly important because of both the immediate and the long-term potential impacts of the secondary effects. So, and they also have, you know, within a particular country, there are lots of factors that are beyond the borders of that country. So there may be global issues such as commodity prices, oil prices, things like that. There may be other sort of more regional effects such as cross-border trade, you know, whether markets are functioning, and things like, particularly important in many countries, are around remittances. So people are migrating to countries often in the region where they're working, but across borders, and for work, and then remitting money back. So, you know, for example, in Nepal, for example, it's something like 25% or a little bit more of the GDP is actually remitted from workers outside of the country. And, you know, what you're finding is that, you know, that's dropping off a lot because places like India, where a lot of migrants are going, are locking down and no longer can support those migrant workers. So the remittances are going down, but also people are starting to return to Nepal. That's also, you know, potentially going to happen in somewhere like Yemen, where, you know, it's like 15 to 20% of GDP as well. About $4 billion US are remitted into Yemen every year. So these are kind of like some of the big effects of COVID-19 applying regionally. And then, of course, you know, there's effects within the country, particularly economic effects, ability for markets to function. People's livelihoods are at risk, particularly in urban areas, and so on. We can maybe bring some of those up more in the Q&A. So when we're talking about you know, learning lessons from other countries, it's also what is unusual, I think, about COVID-19 is that the targeting of people who need assistance is not as straightforward. So we have our classical humanitarian target group who tend to be refugees, IDPs, people affected by short-term shocks. And we have our classic sort of social protection caseload who are the chronically poor. With COVID-19, both of those groups are still vulnerable and will require some assistance. But we're not just dealing with those usual suspects, if you like. We're also going to be dealing with people who are not normally on the books of either the humanitarians or the social protection you know, providers. So, you know, I just mentioned that example of migrant workers coming back to a country, you know, no longer having an income. They're going to be a burden on their families, but they also may need assistance themselves. And they may also be carriers of COVID-19 as well. That's another element. But anyway, you know, we're very much dealing with an unusual situation where you know, our targets are still the chronically poor and the displaced and so on, but there are other people as well. So this really takes us back to, you know, the meat of this discussion, which is around the grey zone, if you like, between social protection and humanitarian, and how to link the two together effectively. And I think the two previous, Gabby and Natalie, have already sort of touched on a lot of this. Just to bring up some of the, you know, the usual kind of challenges around things like transfer values. Often with social protection systems, the transfer value is very, very low, but coverage can be very high, as opposed to humanitarian systems where the coverage is usually quite low, but the actual transfer value is quite high. So the impact is big, the coverage is low, as opposed to low impact with social protection systems, but a wide coverage. There are other aspects that come to mind, things like interoperable registries and data protection. It's actually really quite hard often for humanitarian to share data amongst themselves, let alone with a government. And of course, that becomes much more complex when the government is party to a conflict, in the case of, say, Nigeria or Yemen. So there's all sorts of issues around data protection and interoperable registries, which is a technical problem, but it's also a legal problem of how to share data effectively. I think Gabby brought up the whole kind of coordination issue, which has become super complicated when you're dealing with not just coordination in the humanitarian system, which is also difficult, especially for cash, but also you know, looking at government systems and coordination with more development agencies and donors. So that whole kind of coordination mishmash is very challenging, but again, there are opportunities for that. Other opportunities that come to mind, of course, is, you know, we're dealing with a socioeconomic problem largely, so cash is a very appropriate modality, but also to bring in livelihoods, cash plus approaches, you know, that kind of approach to look at how people's livelihoods can be maintained, protected, but also reintegrated in the future. So, and that really brings me to my final point before a kind of a slight reflection. But I think, you know, I think also Gabby sort of mentioned this, that the importance of thinking immediate, but bringing the medium and long term into the immediate response as early as you possibly can. So we are talking about, you know, having an immediate response to help people at the right time, but also looking at, you know, the opportunities for messaging on COVID-19 issues. We're talking about things like, you know, protecting livelihoods, building livelihoods towards the recovery phase, and looking at sort of the macroeconomics as well of all of those issues. So I'd just like to think also a little bit about, you know, we often talk about, you know, social protection and humanitarian as being completely different things, and often, unfortunately, they are. And it's not just a question of, you know, humanitarian evolving towards a social protection system, perhaps, but actually, I think in this particular context, we could look at how the social protection and humanitarian can work together. And I think Natalie also brought this up a little bit. When you think about most of the social protection systems, they, as I said before, they have a very large coverage, which is something that is probably very, very appropriate, you know, in this kind of response, but a relatively low transfer value. So the impact is relatively low. It doesn't meet basic needs, you know, which is what a humanitarian system is more geared towards. On the other hand, you have, you know, you have a humanitarian system that's very nimble, has a lot of capacity. Zara brought up all the sort of technological progress that we've made in the humanitarian world. So to bring that to bear is also very, very important. Equally, the targeting, as I mentioned earlier, we're not dealing with necessarily the usual suspects. There are lots of other people who would not normally be targeted either by social protection or humanitarian systems. How do we capture those? So I think, you know, building those systems together rather than one or the other is really what we need to be doing. And it's not just a question of linking, it's actually how do they work together effectively. You know, can we achieve a great deal of coverage through having a social protection system? It can be very fast. It can provide top-up sort of vertical increases. It can be, you know, very quick at doing that if it's there. And then the humanitarian, sort of more nimble humanitarian system to try to identify, to capture people who are falling through the cracks, the exclusion areas, if you like, from this social protection system, and to be able to provide assistance, you know, in a fast, effective way that the kind of like more slow, structured social protection systems can't do. So that's kind of like one of the thoughts that I've been having recently to how to make those things work together in a more of a synergistic way. I'll stop there. Thanks for listening, and I'll hand it back over to Zara. Thank you.
And you can keep your video on because we're going to move, and I'll ask Natalie and Gabby to join us as well as they're able with connectivity. Thank you so much for that, Callum. And we are getting a ton of questions coming in. I think some of the main questions that are coming in and that we keep hearing over and over again, and I would love for everybody to be able to reflect on this. I feel like you have in some shape or form, but it is very much around the delivery and registration, and, you know, what does that look like? Do we have any good practice or things that we are seeing around this? And by that, I really am looking at, it's one of the problems, right? Where we keep talking about coverage and saying, do we have the coverage from the big government programs that have started up? And the answer to that is no, we don't. So, you know, how can governments themselves are struggling to get people registered, to figure out who are the people, to verify who are these people, etc. So I'm trying to figure out, you know, do we have examples that we can be bringing up in terms of what that could look like? Social registries is one of the answers. It was something that Gabby mentioned at the end of his presentation, but of course we've got the technical and legal problems around that we're looking at. So I'm going to open it right back up to the panelists, and you can go like this if you feel like you really want to be able to address the issue. It's all the questions that we are grappling with right now are incredibly difficult. When the 4 of us were having or 5 of us were having our briefing ahead of the webinar, we knew that we would not have answers. What we can do is give ideas right now, like, can this work? Can this work? We've seen this from this location, etc. So to open it up to you guys in terms of, do you have good practice? Have you seen things working in other areas that we could be using right now? Also, for any of the 300 people, 300 of our friends just watching us do this right now, if you have examples and things like that you have seen working, if you can please share those also. All right, 2 hands up at once. Gabby, we'll start with you, please.
First of all, I think as important as the social registry is, the crisis provides an opportunity to actually build the registry. So in other words, we can start first of all by having various partners have their own registry, but agreeing later on, post-crisis, to have some transition into sharing the data that can feed into the registry. That will help afterwards. So it's not so much, you know, we need to deal with the registry as it is already comprehensive, but how post-crisis we can contribute to building that registry. In terms of example, I will leave that to Natalie, because I think she has a regional scope and definitely can give us some example. But like I said, let's see this as an opportunity to build a registry.
Thank you, Gabby, and I fully agree with you. And I think that some governments have shared interesting experiences of using for this specific crisis, not the social registry that was more focusing on like specific targeting criteria, but using other source of information like the registries of informal workers or taxi drivers or transport companies, retailers, where that and ILO can support this. UNICEF also, like the partners have also information, but mostly the ministries have some really interesting information that can be used to expand the coverage and fill also the social registry. In West Africa, we have a few interesting examples. Senegal has expanded its social registry really quickly, but Senegal is quite a small population. So I think, if I'm not mistaken, that the registry is now covering almost half of the population, but it was a real will from the government to really go fast and to push hard. My point here is that the political will to expand the registry is key, and I think that this is a discussion that we're often having when talking about connecting humanitarian CVA and social registry is, what is the initial intent with a social registry? Is it to cover the largest possible part of the population so it can facilitate the response to any shocks happening, natural disasters and epidemics? Or is it more something to tackle chronic poverty, and then it's just limits to the poorest people? And that is often a challenge for humanitarian who have very specific targeting criteria. Togo and I think Kenya, maybe Kalam can correct me if I'm wrong, but I think that are both using self-registration processes. which is very much less expensive because all the registration process is a lot about funding and resources available. So when you do self-registration, people fill up a form, whether there is a committee in their neighborhood, or there is an online platform or a phone number to call, like in Togo. And these are interesting initiatives. There is also maybe a broader consideration for donors and bilateral partners who are supporting the funding of social programs in these countries, is how costly is the development of registries and how expensive is targeting. And in Ghana, we had the conversation for a while with the support of UNICEF, and like, should we go for universal coverage? And isn't it just more cost efficient to go for universal coverage? Mali is also a very good example of collaboration between humanitarian and governments in sharing data to expand the registry. So it has to come with clear MOUs on data protection and data management. But we have guidance for this, and the main obstacle is often will to collaborate. And if we have this, then we can do great things.
Great, thank you for that. Callum?
Yeah, thanks. I was actually thinking about Turkey as a kind of like quite an interesting example, the ESSN in Turkey that you know, people are usually fairly familiar with. But you know, in that case, it's rather unusual because it's a kind of a humanitarian crisis, if you like. But actually, the government, rather than the humanitarians, have the data. So, you know, it's not really a social registry, but it's a registry of refugees who have come into the country. One of the interesting things about it and the opportunities there is that the whole targeting system is based upon that. So, you know, it's a categorical targeting system around things like, you know, family size, number of children, disabled people, yeah, things like that. So you can kind of like target automatically by running those criteria through the database to be able to select your beneficiaries. So I think that's one of the, you know, potential uses of having these sort of large registries that are unified, held by one, you know, central authority in order to maintain that. I mean, in contrast, you know, there are so many examples around the world where registries or databases don't talk to each other. They're not interoperable, and you can't share data either because of a technical problem or because of you know, data protection regulations, which you know, need to be respected. And I think particularly, you know, perhaps it's easier to do in a country at peace without any kind of conflict going on, and it's much more difficult to share data in a country which is in a state of civil war in particular. And I mentioned earlier, you know, humanitarians sharing data registries, you know, beneficiary personal information with governments who are party to a conflict is very dangerous. So we have to be very careful around those sort of things. Yeah, I think that's what I would like to contribute.
And there's something to be said as well. Yes, sorry, Gabby, go for it.
Well, I do want to, and this may be evident for social protection specialists, but I think a point to be made is that a social registry just provides you now the opportunity to identify a beneficiary registry, which is different. Okay, so I think it's important that we don't use beneficiary registry as synonymous with social registry, and that you first of all use the social registry to identify and then register and then come up with your beneficiary registry. Thought I'd just make that point.
Yeah, no, that is an important.
Thanks to Valentina.
Yes, that is an important point to make, because I mean, we just say social registry without, from the humanitarian side, say that without actually realizing what that actually means and what it looks like. I don't even like the word social registry. I tend to go with social protection information management system, which should cut across all different sorts of ministries in an ideal situation and scenario. One of the, this is not the time to have lost my train of thought, but just one of the things that you know, we haven't quite talked about, but you know, you've sort of mentioned it, Natalie, that there's other ways in which to get these lists together. And maybe we are looking at different sorts of multiple lists and hopefully not creating. And one of the questions and comments, and I am keeping an eye on them and trying to, I'm not calling out your names and saying this is the exact question. I'm trying to group them together and cover it all through one sort of cluster of topics. We don't want to create a parallel system. We've got issues of social, or not social, but physical distancing in place. And if I can ask all of you to reflect a little bit on the role of civil society. I'm also bringing this up because this had come up in, we have this informal hangout that we do on a weekly basis. We can post the link in the chat box, but this had come up in the case of Kenya. And I'm not going to call out the person who is logged on listening to this webinar right now, who had mentioned this. And I thought it was quite an important point, saying, as a humanitarian actor who does have links with local organizations and local partners, and they do have these sorts of lists right now. They do know who is vulnerable within their community, and they are trying to find this entry point into looking at, what is the government doing? And Kenya, they're great government, very sovereign state, doing what they need to do, but there are people being missed out, and they're like, so where is that linkage that they can be making, and how can they be bringing this into the equation? Obviously, coordination and leadership around this coordination is one of the big issues, but I just wanted to see, we talk a lot about localization. We talk a lot about localization. This is the time that we really need to be looking at it and bringing it into play. So if there are any reflections in terms of, looking at it in terms of lists, looking at it in terms of linking social protection and humanitarian cash transfers and the role of civil society. Go like this, and it's I did tell you guys that we were not gonna softball any questions. We were going for the hard stuff. Yes, Natalie.
Well, as we discussed, I don't think there is an easy answer, but what we know and what we see is that the bigger the player is, the less flexibility he usually has to access the most remote people, or to target specific groups, or to know the details of each household situation and stuff like that. So typically, I think that one added value of the collaboration between government and humanitarian actors, generally speaking, is that humanitarian actors can provide much more flexibility and much more detailed information. But the humanitarian world is very large, and not all humanitarian actors are the same, for sure. And yes, we should definitely use more the knowledge of local actors. And I think that once again, the particular context of a pandemic is an opportunity for these actors to sort of rise up, because, well, most international actors will not take any risk of being exposed, and there are, again, like relying back on Earth structures, like we see civil life, national safety services, and the Red Cross, the National Red Cross movements are very often at the front line of managing epidemics. So whatever it is, cash or in-kind distributions, if those actors, health services, Red Cross movement, are in charge of case management, tracing contacts, case, and so on, we should combine, we should rely on them to also ensure some distributions. The Red Cross movement have built very strong capacities in getting prepared for cash distribution with different modalities. And I think it's really their time to step up and yeah, make that last mile work.
Thank you. Anybody else on that one? Yes, Gabby.
Yes, and just to add on to what Natalie said, and I fully agree with her, is that civil society also play a very important role in ensuring transparency and accountability. And you have already in some countries platforms of civil society on social protection. And I know Kenya has just a platform. In fact, there are a number of them in Africa. Kenya has actually the headquarters of the civil society platform for social protection. So it is basically how do they engage now with the coordinating, within the coordinating mechanism in terms of the response. and to make sure they're there. And I think the humanitarian actors do a far better job in linking with civil society than the government.
Thank you. You're hitting on a couple of key sorts of areas that I want to get into. And unless you have something burning to add, Callum, I can transition us over to those sorts of things. There are a lot of questions around accountability that are coming up and what we can look at and what exists around that, because there is a differentiation between how government looks at social accountability and how different international organizations or agencies have standards around this that we are required to meet. So just to open that up to the panelists, do you have examples or ways in which you have seen at least the humanitarian side, or even I would say the international development side, being able to strengthen accountability measures, mechanisms? This is connected as well. It's not just about feedback and grievances, etc. We've got a couple of questions as well on M&E and how to be able to do that a bit more effectively when we are looking at the link between social protection and humanitarian cash transfers. And I really see this as an added value that the humanitarian side can be bringing into the social protection side. Maybe it is, maybe it isn't. So to open that up to you guys in terms of examples or anything that you might have seen.
Maybe I can just kick us off anyway, as there's nobody else queuing up. I was just thinking about the accountability to affected populations side of the accountability equation, and you know, I think one of the interesting things that have been done quite recently, particularly in the Middle East, is to have remote accountability systems. So using phone centers in particular to be able to sort of do third-party monitoring in a sense to make sure people have actually received what they were supposed to receive through large samples, but also to receive complaints and feedback from beneficiaries, you know, through WhatsApp as well as voice phone and all those sort of things. I don't think, to my knowledge, that that's particularly well developed on the social protection side, and I think that might be something that works pretty well in the humanitarian arena and could perhaps be transferred into social protection side, open to be corrected.
Anything from
we had very interesting discussions, and I think Gabby, you may know more without putting the spot on you, but like within the community of parties of cash transfers, there have been some experience sharing in like former meetings of governments putting in place accountability mechanisms that I can't remember of right now. So maybe after the webinar, if we have the chance to like find a few examples, I fully agree with Callum that this is definitely something that the humanitarian work can bring to the social protection actors, but also acknowledging that the scale is not the same, and so the capacities and the funding to manage such a mechanism for large-scale nationwide programs would be very different. And also, I think that the legitimacy issue is very different. One aspect of the humanitarian aid is that sort of external actors coming to provide assistance. And so if we talk about like ethics and philosophically speaking, I would say the government is in charge of protecting their citizens and of ensuring, so they have the legitimacy to provide assistance. They have a sort of a social contract, a mandate to do so, when NGOs and non-state actors don't have this. So not saying that the government is not accountable to its population, on the contrary, but they have a sort of a mandate to do it. So it would be great if the social protection actors would build more feedback mechanisms and stuff like that. But when we know that the resources are lacking for delivery of large-scale assistance, and I think that this is, whether we like it or not, really the priority for at the moment.
Thank you for that. Gabby, unless it's burning. No, not burning. Great. There is also an example, I mean, because, you know, we can see, again, I'm looking at the different comments and things like that. There's one from Luca, Cash Working Group Gaza. You know, he's asking about examples of alignment between CVA and social protection systems in regard to monitoring of cash transfers. That's not the question I'm putting to you. What I want to take is what he says after that. It's, is this something we should be looking at as well in terms of pursuing the linkage? And in one of the webinars, it was around the Turkey ESSN one that we had as well. You know, one of the questions that we had addressed as a panel there was, you know, what is the incentive for government to also work with the humanitarian side? And it is like, you know, we can be bringing new technologies, we can be bringing frameworks around social accountability or whatever it might be. We could be bringing in and the technology around, you know, data management or registration, having these call centers, looking at what monitoring and evaluation could look like. So, you know, it's for us to realize when we talk about linkage, it could be as simple as doing these sorts of things. You know, it doesn't have to be, let's use the whole entire beneficiary list or social registry that a government has. Let's use their bank accounts or whatever it is. Like, linkage can be also soft linkages, but it's very much around this coordination aspect. And I do want to get back to the coordination aspect, which we keep coming back to again and again and again, but it is really key to discuss this, because that is, you know, the first entry point, because if we are not coordinating, we don't know what each side is doing. Gabby, in your last comment, you had talked about, you know, that there are these platforms that exist in country on social protection. You know, there tends to be a social protection working group of some shape or form. Are humanitarian actors involved in that? And I'm going to piggyback this off of the comment that Natalie was making around the Red Cross movement, and my Red Cross colleagues will forgive me, but I still feel like I'm part of the move. It's what I grew up in. But, you know, in terms of localization, national societies tend to be an auxiliary of the government as well. This tends to be written into, you know, constitutions, laws, etc. So they have a seat at the table. I'm not saying this is the same, this is in every single country around the world, but in terms of gatekeepers who can bring the humanitarian voice and perspective to the social protection forums that exist in a country. UNICEF and WFP are two other pretty major actors who tend to have a seat at that table. But just to hear from the panelists around, you know, how do we start getting at a very practical level? You know, we can keep saying, yes, we need to coordinate. At a very practical level, what are those entry points around coordination, around getting that conversation started? I will start with Gabby, because you were also like nodding your head quite a bit. But if we have practical sort of points for people and recommendations for humanitarian practitioners.
Yeah, I was more nodding my head and agreeing with what you were saying, rather than having an answer. Let me go to my crystal ball. No, yeah, no, but basically, I mean, I think that there's certain, like I said, the first entry point in for us is where there is already existing government coordination mechanism, is to get yourself involved with that through, it doesn't have to be directly, but it can also be through UNICEF, through WFP and others, because they are partners with WFP and UNICEF, and so, and the Red Cross. So as partners of that entity that already has a seat at the table, to join in. Secondly, like I said, the cluster, once the cluster approach is there, how do you get involved there? And then third instances is where do you have very weak national coordination mechanism? The humanitarian can play a very important role in establishing that coordination mechanism as a sort of incubation, waiting until the national response begins to formalize, and basically then makes a transition. And that was the case in Liberia. Oxfam actually started with a cash working group with the Red Cross and others, And they invited us to participate. It was at that point that we said, okay, we need to have a national coordinating mechanism. And so we all agreed to come together under the national. But this was a very good example where Oxfam had actually started taking the lead.
Yeah. Anybody else? And Callum, you are jotting down notes, so yes, please go for it. We can't hear you and your video turned off. There we go. There we go. We're there. Yes.
Very easy to turn your video off and your sound on. Anyway, yeah, I was reflecting that actually. Totally agree with what Gabby was saying, but really, I think the donors have a key role to play in this. And I'm sort of thinking about, you know, I was working in Ethiopia fairly recently. You know, there's a very good cash working group in Ethiopia dealing with all the humanitarian cash that goes on there, and there's a even better, if you like, social protection cash donor group that are working on the PSNP in Ethiopia. They don't talk to each other, right? But which is the problem. But of course, you know, you've got the donors who are supporting both the humanitarian and the social protection system, who often don't, you know, different bits of the donor organizations don't talk to each other either. But I think, you know, I really think that the donors have a very important role to play in both trying to harmonize cash transfers, you know, in the humanitarian sphere, but also to try to make those linkages between the social protection and the humanitarian system. No, in a sense, people follow the money. So I think the donors also have a, you know, quite a good points of leverage to be able to insist upon certain standards, upon certain ways of working, that you don't set up parallel systems, for example, that you can piggyback on social protection systems or whatever it is. I'm just picking things out of the air, but you know, there is a potential for donors to really leverage the response in that kind of direction, and to insist upon, you know, partners to be able to do that. I think the other part of it is that I think donors, because of their particular status in a country, have a very important role to play with governments, and certainly in the social protection system, which is usually led by governments, I think donors can play a very important role in coordinating those efforts. So I'll leave it at that. But yeah, I think all the other bits of the equation are very important, but I think we need to start with the donors.
Yep, no, and that is a good one to hear. Natalie, you wanted to add something?
Just maybe one thing that what we see very often is that there is a sort of mistrust, like natural mistrust from humanitarian and government sides. And I think that what you just said is very important, that we should assume that the government has no incentive, particularly in coordinating with the humanitarian. So it makes sense for humanitarian to make some efforts to connect with the government. And it can be very frustrating when we have to send official letters, to invite a cash working group meeting, but it's just the beginning. When you reach the personal relationship, you don't really need this anymore. And so we really need to make this initial effort and to invest in it, because if we don't do it in, as we said, quiet periods, then it will happen and we will be stuck in such context like now, where we need the government leadership and we have not invested the necessary time to make this happen on time.
There's also, and this is coming up in a lot of different forums that I'm a part of right now, et cetera, there is this absolute need for humanitarians to also understand how government works, especially if you are going to work in this space around social protection and cash. And a very simple, teeny tiny, practical thing, if you're going into a country and you are coordinating with government, they do not speak our acronyms. Like it is incredible to sit in an emergency in meetings, and you know, we'll be talking about like GBV or accountable AAP or PSEA, and you know, just throwing these terms around and talking about clusters as if, you know, as if this is something that everybody understands. But this is not, you know, we live in our own bubble, and I think being able to bridge between the two worlds is it's incredibly important, and to send people in with the soft skills who are able to do that. Also, just a small practical point on that one, you know, I think it is quite incredibly important. We have about 5 minutes left. I am wondering if we can quickly touch on targeting an MEB, because it is another one that has come up on the list of questions a little bit in terms of, what do transfer values need to look like? And I'm going to take it into a particular sort of nuance. One of the big problems that we tend to have, COVID or not COVID, is that government social assistance is pretty much never as high as the minimum expenditure basket, the MEB that we keep talking about. We have begun to see that governments are increasing, and this is from the World Bank paper, the Social Protection Weekly Links, that World Bank, Ugo Gentilini, etc., they're putting this out every week. So you can sort of see and track what is happening in each country. Sorry to keep picking on Turkey, but it's coming up. And given, Callum, your recent, the job that you used to have, maybe there's some light you can shed around this. But in Turkey, we were able to see that the transfer value that the government gives has been raised. There was a lot of discussion that happened between the ESSN and the social assistance program to look at some sort of alignment or whatever it was. Is there a case now to be made if we are seeing the government's value going up for things like, the MEB to be a bit better aligned or whatever it might be? Is this the time to be doing some sort of advocacy around this? Because this is the time that we can be doing those sorts of things. But just to touch on transfer value versus, or government transfer values versus minimum expenditure baskets, what do transfer values look like in the age of COVID? Where should humanitarian actors be pivoting around this, keeping in mind that link between social protection systems? Callum, I'm so sorry to put you on the spot with this one, but
That's okay. And I managed not to turn my video off this time, which means that I'm getting better at this. Yeah, going back to Turkey, the ESSN right from the beginning was WFP at that time actually calculated the MEB, and then the Turkish government basically capped it. In terms of saying, for the sake of to maintain relations between the host community and the refugees, then you can't give above a certain amount, which was capped according to the average amount that poor Turkish families would receive under the social protection system. So it was kind of like and that happened in Greece as well, and it's happened in a number of places. Yeah, exactly, Lebanon as well. So I don't think it's terribly unusual, except where you have, maybe on long-term hardcore humanitarian programs where the MEB is respected, or at least there's a contribution to the MEB which would be still quite a lot greater than the social protection transfer value. And of course there is a reason. I think it's worth going back to the reasons of this and then to reflect on that in the current COVID responses. I mean, if you're the whole sort of basis of social protection is that people are receiving a regular transfer, whatever that is, over a long period of time. So that can be 5 or 10 years even. Whereas with a humanitarian system, and it's to reduce poverty, of course, and with a humanitarian system, you're receiving much shorter time spaces of assistance. Your needs are perceived to be greater. You may be displaced, no longer have access to your livelihoods, etc., etc. So, the actual objective of a humanitarian transfer, I'm talking to everybody here who knows this, is to meet basic needs in a crisis for a shorter period of time. So, it's quite natural that the transfer values are different. I think what is the challenge now with the COVID-19 response is to somehow find a way of harmonizing those or rationalizing it. And the whole transfer value thing is also, it's a triangle in a sense between coverage, impact, and resources. So it's if the COVID-19 response requires a large national level response that does almost like universal targeting somebody was mentioning, then you can't possibly give a humanitarian MEB to millions and millions of people. It would cost billions and billions of dollars, right? So that's not going to happen. So there has to be a sort of a rationalization around this, around resources as well. Equally, I think as I was kind of like starting to say earlier, I think there is a space for different transfer values to meet different needs. So if you had that very large, wide coverage from a social protection system with a relatively low transfer value, that provides a kind of like the basis of a response. People are going to, there's going to be exclusion errors, there's going to be the people who are not normally on the registry and so on, who suddenly become vulnerable. Those could be picked up by a more humanitarian type system, which could be based upon an MEB, because they're in a particular category. Maybe they returned from, you know, if they're migrant workers returning from a different country or whatever. So I think there is space for different transfer values, but you know, if they're different in so hugely different, I think there's a problem of equity there. So we need to be able to rationalize and to maybe bring the social protection system, you know, top it up, vertical expansion, whatever, and perhaps not go for a full MEB, you know, in a more of a humanitarian based system, so that you don't necessarily meet it exactly in the middle, but you're kind of like getting within orders of magnitude of similarity.
Brilliant. Thank you so much. I am going to give everybody, we're totally over time by like a minute, but I think that's okay. I'm going to give everybody 30 seconds. It was something that we had talked about doing, is I would like to hear your hopes, dreams, ambitions, one on a practical level and one in a crazy blue sky thinking level, as your final reflections for people to take forward. And I will start in the order in which you are on my screen with Natalie.
Thank you, Zira. So one wish that, and it may not be as crazy as you would like to, but one thing I didn't mention when I was talking about like bilateral donors supporting social protection systems development and so on, we tend to forget that the social protection is a government-led system normally, and the responsibility from governments to fund it and to ensure its sustainability and inclusiveness is very key. So my first blue sky thinking thoughts would be, we have many information from the World Bank and calculation of how much governments should invest to make their social protection systems sustainable and just operational to face this type of crisis. I think that it's really time to make this happen, and I don't know why it's not happening. Like, we know, but that would be like my wish.
Yeah, no, it's a great wish. Yeah.
The more realistic thoughts would be, I think that we just need to make cash happen now in the COVID crisis, before markets get much more impacted, before incomes loss becomes even more dramatic on people. And I think that this is not only a very realistic thought, but the only reasonable plan to have right now. Yes, there are operational challenges. Yes, some systems are not in place, but we see countries doing it. Like we see Burkina Faso doing its best. We see Cabo Verde, Nigeria doing it. So I will continue to push for it.
Great, brilliant. Gabby.
Yeah, building on what Natalie said, from a practical standpoint, and this is something that we missed the opportunity in Liberia, is to have a joint impact evaluation post-crisis. Collectively, as a humanitarian and all the actors, our collective response in terms of cash transfer, what was its impact on restoring livelihood and building resilience? We need that evidence that will also help us to determine the adequacy of transfer as well. Now the blue sky thinking, and this is where you become very broad. This is an opportunity, I think, in how do we build on this to invest now on system building and helping government achieve the universal social protection that is part of the SDGs.
Yep. Brilliant. And yeah, it's around legacy of investments, which we haven't talked about or looked at, but yeah, Callum, last word to you.
First of all, just to go back to Natalie's, I totally agree, do cash and lots of it. So let's get it out there. That's the only way that we're going to really protect people's livelihoods. So I think that's really, really important. Just on the slightly more blue sky thinking, perhaps, I see things in terms of opportunities to have a kind of a layered approach to the response and also to sequence things. So you know, the layered approach is around kind of like having a social protection system provide the basis of the response, and then, you know, having a more nimble humanitarian system come in and pick up, you know, people who are falling through the cracks and have a very strong protection and gender lens to be able to do that. So I think that's kind of like the layering part of it. I think the sequencing thing goes back to Gabby's original point in his presentation, was the, you know, thinking immediately but also into the longer term. So can we develop programs from the initial response that also build in longer term sustainability, livelihood approaches, you know, so that we don't need to wait for those things to happen. We can do things immediately to help people, you know, when they really need it, but then to really sort of build in longer term resilience, sort of building, if you like, approaches as we go forward into more recovery. Thank you.
Huge thank you to all the panelists and all the questions. I did not name people, but, you know, I was pulling from the different questions as they were coming in. We will try to do the best that we can with the Q&A wrap up and the summary that goes out. The next series for the social protection response to COVID is Tuesday, the 21st. It is around the impacts of COVID-19 on employment, looking at the informal and self-employed workers. It's going to be super interesting, so do log on. The next Grand Bargain subgroup or cash subgroup webinar is going to be May 21st, TBD in terms of what we're going to talk about and what we will look at. Massive thank you again to all the panelists, the discussion that has been taking place in the chat function with all the questions, and we will see you next time. Stay safe, everybody out there, and we hope this was useful. Bye-bye.